Benzodiazepine, sometimes called benzos, is considered as a drug with high addictive potential. Benzos are widely prescribed to treat various conditions, particularly insomnia and anxiety. Therapeutic dependence are the largest category of people dependent on benzos. Benzos are one of the most prescribed drugs which have abuse potential. What are benzos for? Can anyone tell us? One or two?
It's like calming.
Yeah, what is it for? Pardon? Stress? Anxiety, yeah. Okay. Therefore, emesia before or after surgery, anxiety, generalized anxiety, panic, phobias, post-traumatic, obsessive, compulsive, insomnia, somatoform, convulsive, tetanus, and paraplegia. Types of benzos are long, intermediate, and short acting. The following are different names for benzos. These are different names for benzos. And there are fake benzos called street benzos. Street benzos, which are chemically similar to benzos, have been found to contain some very harmful substances and are causing hospitalization and death, especially in the UK. This includes tablets marked with DA. How it looks like. They come in form of a pill or tablet, capsules, or injections. They come in wide variety of colors and different shapes depending on their types. Fluodomazolam and etizolam are newly benzos, which are chemically similar to benzos and can be dangerously high in potency. You can see capsule and difference of color, and the one of Xanax come in white, pink, or light blue over page, can also appear in form of white. And we have chloroquine, is a cycle, blue pill with K in the center. We have Librum, comes in capsule form, and it is awful green and white, but colors can be varied. Valium, this is seen as circular white pill with a V in the center. We have Ativa, often appear as a white. So we go to the next one. The dose and how it's administered. Dose amount depends on the specific type of benzos prescribed and the purpose of taking it. As you can see, here are the dose. The Ativa has its dose, each one. And low dose of benzos are Ativa, Xanax, and chloroquine. But Libron and Valium are prescribed in larger dose. Benzos are commonly administered via the oral, intravenous, rectally, intranasally, and intramuscularly. Some people crush tablets, so notice, some people crush tablets to inject them. This is extremely dangerous and can lead to skin infections and access and rapid, potentially fatal overdose. So, benzos functions and how long it stays in the body. According to Jenny Jacobs, benzos help people sleep after taking stimulants. Some people use them to help calm down of acid, cocaine, speed, or ecstasy after a big night out, after the party. you know. So you can use this to calm down yourself. Some people use them to help come down off, as I've said before. After taking Benzone, it takes about 30 minutes before it starts working, depending on the type of Benzone. The length of time that benzones are detectable in a person's system depends on the testing method and the requesting of benzone's use. So you can see on urine, when benzones are taken as prescribed at typical dose, they can stay in person's system for 3 to 7 days. But chronic use, they can be detected for up to 30 days. So with the blood, the hair test can detect benzone's use that has occurred within the past 3 months. Saliva test can detect benzone's use within 48 hours. So benzone can also be transferred to infants via breast milk. So you can find it if you are interested to know more about it. Side effects and risk. They slow down the body and brain functions and could make individual unsteady or fit and slower reflexes. As you can see in the image. Benzone side effect includes long and short-term effects. Short-term effects are dizziness, lightheadedness, confusion, memory issues, lack of balance and coordinations, sedation, appetite changes, nausea and vomiting, dry mouth, fatigue, weight gain, and sexual diffusion. So we can see the risk. So I will explain the long-term effects. Long-term effects can be more serious. Continued uses of benzones could make individuals develop an addiction to benzones and experience withdrawal symptoms when drug uses stop. An individual who develops a dependence on benzones for long-term use, withdrawal symptoms can include tremors, anxiety, panic, attack, vomiting, muscle pain, headache, heart palpitation, sleep disturbance, and difficulties concentrating. So here are the physical, it has 3 types of risk: physical health risk and mental health risk. So have law against this drug. It's not everyone that can use it. So this is a class C drugs, which means it's illegal to have for yourself, or to sell, or to give away. Possession can get you to 2 years in prison and unlimited fine, or both. You see why you should not take it. It's very dangerous to take it to sell. Possession can get you to 2 years in prison and unlimited fine, or both. Supplying someone else can get you to 14 years in prison. If you are caught driving under the influence, taking it while driving, you may receive a heavy fine, driving ban, or prison sentence. If this drug is supplied in the club, in a hostel, or home, the landlord or club owner or manager of any premises can be prosecuted for that. Conclusion. Benzones remain to be one of the most prescribed agents for a variety of anxiety and sleep disorders. Keeping in mind their highly abusive potential, clinicians or special attention towards patient addictions and medication history before these agents are prescribed. proper education of patients, regular follow-up, and using alternative therapy can reduce the risk of benzo and dependence. Thank you for listening.